Hi everyone, this video will be about the relationship between vitamin D and our metabolic health with the question, does vitamin D supplementation help maintaining weight and preventing obesity? We get major of vitamin D from the sun, so many people think that if we go outside every day, we will get enough vitamin D, but that is not the case. So, why? Because the clothes we wear affect vitamin D synthesis. Not only clothes, time of the day, season, latitude, and sunscreen all dramatically affect vitamin D synthesis. So that's why many countries that have a big amount of sunlight hours still have high vitamin D deficiency percentage. Let's look at the vitamin D deficiency map together. There are some countries that have high percentage of vitamin D deficiency, including Canada, United States, India, China, Australia, and Russia. And then let's look at an obesity map. Could you see the link between them? Some countries that have high percentage of vitamin D deficiency also have high percentage of obesity, including the United States, Russia, China, and India. So through this video, I will talk about metabolic health, vitamin D, and go through 3 research and my conclusions. So what is metabolism? Metabolism is a complex set of biochemical reactions that occur within our cells to sustain life. It involves a series of chemical reactions that convert food into energy, eliminate waste products, and build and repair tissues. Metabolism can be divided into two main categories. The first is catabolism. This process involves the breakdown of larger molecule and releasing energy. The other is anabolism. The process is responsible for building larger molecules from smaller components, and it requires energy. So basically, metabolism plays a crucial role in determining how body use energy. As a researcher at the University of North Carolina says, 92% of people with overweight and 99.5% of people with obesity were metabolically unhealthy. So how can metabolism maintain our weight? It begins when we eat. The calories we get from food is our energy intake, and metabolism is the one that can decide our energy expenditure. First is basal metabolic rate is used 60 to 75% of our energy for body function at rest and thermoneutrality. Next is thermic effect of food is used 5 to 10% of our energy for conversion of food, include digestion, absorption, transportation, storage, and metabolism. Next, we have physical activity and exercise is used 15 to 30% of our energy. Final is thermogenesis is used about 5% for non-voluntary activity and trigger. Vitamin D. According to Health Mart, in the US alone, 42% of adults are deficiency, while 50% of children aged between 1 and 5 and 70% of children aged between 6 and 11 have low vitamin D store. Vitamin D include vitamin D3 found in animal products and vitamin D2 found in few plant products. Most of vitamin D is synthesized in the skin. We get small amount of vitamin D from our diet. Vitamin D is really important. It's also be called as a hormone because of its involvement in many functions, including metabolism. To activate vitamin D for our body to be able to use it, it requires two hydroxylation. The first one is in the liver. Vitamin D is converted to 25-OH, vitamin D3 form. After that, it goes to the kidney and converted into the active form 2.25-OH to vitamin D3. Vitamin D has many functions and brings many health benefits for our body. The first function that vitamin D is regulation of blood calcium level, it can increase intestinal absorption of calcium and decrease calcium excretion. Vitamin D also involved in insulin secretion, genomic function by regulating transcription. It's also involved in immune function, cell growth, and differentiation, blood pressure control. So how does this affect metabolism? First thing is vitamin D can regulate blood calcium level. Vitamin D is involved in the regulation of parathyroid hormone BTH, which plays a key role in maintaining blood calcium level. When blood calcium level are low, BTH is released and is added on the bone, kidneys, and intestine to increase calcium absorption and mobilization. So if blood calcium is low but no vitamin D there to help BTH hormone, the body will release calcium from bone, and then bone loss affect metabolism. Also, adequate level of calcium required for proper muscle function include skeletal muscle for movement. But if there is not enough calcium, also not enough vitamin D to help BTH increase absorption, it will also affect metabolism. Besides, calcium also a cofactor to some metabolic reaction, including glycolysis, citric acid cycle, and lipid metabolism. Second, insulin sensitivity is how effectively cells respond to insulin, and insulin resistance is when cells become less effective to insulin, leading to high blood sugar level. High insulin level will cause body to store more excess calories as fat. On the other hand, low insulin make lipolysis happen and body using fat as energy sources. Insulin also improve in appetite regulation. Insulin involved in glucose control. It sends signal to the liver, muscle, and fat cell to take glucose from food. If cells are insulin resistant, it leads to high blood sugar level and causes pancreas to produce more insulin, contributing to weight gain, also slowing down the metabolic rate. Finally, vitamin D helps immune system, so since inflammation is associated with obesity and metabolic disorder, vitamin D can help regulate inflammation and support overall metabolic health. So now I will talk about three research that I found. The first article is a randomized control trial. It aimed to determine for overweight and obese children whether the administration of vitamin D3 supplement 1,000 or 2,000 IU per day or 600 IU per day is more effective in improving cardiovascular and metabolic health. The method of this study is 225 children aged 10 to 18 years overweight or obese, vitamin D deficient children participated in the study over 6 months. Participants are randomly assigned to take either 600 IU or 1,000 IU or 2,000 IU of vitamin D3 daily. Finally, study measurements such as weight, height, waist circumference, blood pressure will be measured at each visit and at the last month. And percentages of total body fat, total lean mass, and total bone mineral content were assessed. At the end of the study, researchers found BMI, waist circumference, and total body fat were reduced in the 2,000 IU group compared with the 600 IU group at 6 months. Insulin sensitivity also improved in the 2,000 IU. The second study was a cross-sectional observational study in Finland. The study investigated whether there was an association between serum 25-OHD concentration and social demographic, lifestyle, and metabolic health related factor. The method is over 5,000 men and women aged 30 to 79 years old who participated in the research will be tested to measure serum 25-OHD concentration and participate in questionnaire, interviews, and measurement to determine social demographic, lifestyle, and metabolic factor. At the end of the study, researchers found that participants with the healthiest lifestyle measured by body mass index physical activity had a higher serum 25-OHD concentration for metabolic health, waist circumference, and HDL cholesterol are strongly associated with serum 25-OHD. The third study aimed to survey to find out whether vitamin D supplementation is effective for weight loss in overweight and obese women aged 20 to 40 years through a clinical trial study. Key method of this study is 50 overweight and obese women were divided into two groups, received vitamin D with dose 50,000 IU per week and a placebo within 6 weeks. Metrics such as total cholesterol, height, weight, waist circumference, hip circumference, blood pressure were measured before and after the intervention. At the end of the study, researchers found out in the group receiving vitamin D supplementation, there was a marked reduction in weight, waist circumference, and body mass index. As you can see, vitamin D really associated with BMI, weight, and waist circumference. So, should we use vitamin D supplementation to protect our metabolic health from that maintaining our weight? I think we should give it a chance. However, it's worth noting that the relationship between vitamin D and metabolism is multifactorial. However, even though vitamin D did influence weight maintenance, it's not the sole factor. We should have a balanced diet, manage stress and sleep better, be more active, and get enough vitamin D are the key for healthy metabolic health and weight management. Thank you for listening.